Okay, so let's talk about when to call your doctor. I'm sure by now you've had your doctor go over this, your nurse has gone over it, and you're like, oh yeah, I know it all, I got my handouts. So I'm sure you've heard this before, but because this is so important, let's go over it once again to make sure you have all the things that you need to know about to take care of yourself or your loved ones. Okay? So, first thing is if you have fever. So that is temperature over 100.5. Okay, so 100.5 degrees Fahrenheit, you want to call your doctor. Or if you are having chills or sweating suddenly and feeling flu-like, those are signs that you might be having an infection, possible infection. So good idea to call your doctor. The other thing is also if you're getting fever, call before taking Tylenol or ibuprofen. And the reason for this is it will prevent masking the fever. So for example, if you took Tylenol or ibuprofen, so now your fever goes down, so we don't know what caused the fever, right? So it's a good idea to call before you take these medications or check with your doctor about it beforehand. So and then when I talk about calling, you don't want to wait for 2 days to call your doctor, right? So if it's a weekend or it's night, then find out from your hospital or your cancer center where you can call during the day or weekday, where you can call at night or weekend, and if you need to go to the emergency department, because sometimes if they don't have an option for you to call at night, they might recommend that you go to the emergency department. Okay? So other things that are associated with fever is if you develop any new cough suddenly or cold or any burning when you go to the bathroom to pee, then those might be possible signs of infection. So again, you want to call and get checked out for those. Okay. What else? Let's see. Well, bleeding from any orifice, any part of the body, it's not normal unless you've already been having that bleeding before. So if you're having nose bleeding, or if you're having bleeding from your mouth or from your anal area or from the IV site, anywhere, if you're having any bleeding or bruising is like if somebody beat you up and you have the black and blue mark. That's not normal, okay? So again, get those checked out, and the reason for that might be low platelets. So platelets are things in our body that help with clotting the blood so that it doesn't leak out. But a lot of times when somebody is getting chemotherapy, then their platelet counts can go down. So platelets are our cellular system parts. They are found in the blood and they help with clotting. So sometimes the platelets can be low when a person is getting chemotherapy, so the risk of bleeding increases. So if you notice blood coming out of anywhere, that needs to be checked out. Okay. Other thing is if you notice any swelling or warmth in your arms or legs. So I'm not talking about like, just a little aching or paining, but you notice that it's red and painful. So like you got a bruise, or it looks a little swollen and feels a little warm. Again, that's something to get checked out. Well, and it doesn't have to be at the site of your IV. It can be anywhere in the body. It can be like in your calf region or in your arms. So anywhere, if you notice that you are having some redness and swelling in your arms or legs, and it feels a little warm, get that checked out, because again, that could be related to some bleeding or clotting problem. Okay. What else? Let's see. Breathing. Okay, so if you are experiencing any difficulty breathing, that's not normal. Okay, so get that checked out right away. And same goes with heart rate. So irregular heart rate, you're feeling palpitations or feeling dizzy, and I'm not talking about like anxiety and we get a little palpitation from that, but you're feeling like, okay, my heart, it's kind of pumping strange, or I'm feeling dizzy, or I'm feeling like I'm not getting good circulation, then that's something to get checked out right away. Okay. Rash of any kind. So suddenly if you find that you're starting to develop a rash where it's getting itchy or red or swollen, then that needs to be checked out. Right. What else? And yes, nausea, vomiting. So as we know, we talked that nausea, vomiting, or diarrhea, those can be associated with the chemotherapy you are taking. So it's possible that you have some nausea, vomiting, or diarrhea. But if you are having for more than 24 hours, or if it's not being maintained by the medications you're getting, or you haven't been able to eat or drink for more than 24 hours, then that's the time to call your doctor. Okay, because it can be dehydrating and you can lose electrolytes. So yes, nausea and vomiting can be experienced after chemotherapy, but it should not be lasting that long, that it affects your fluids and it affects the electrolytes in your body and you're uncomfortable. Okay, so hopefully your treatment goes well and you don't need to do any of this. But if you do notice any of these signs or symptoms for yourself or for your loved one, do call your doctor. Find out where you can call during the day or night or weekend, or if you don't have an option, do go to the emergency department and get checked out. It's possible that it's nothing, but you would rather not take that chance and find out what's going on and have a smooth treatment and recovery.